Thank you for watching our presentation, Benefits 2025, What You Need to Know. This presentation is offered by the Office of Human Resources Benefits Services Unit. Today's presentation has the following goals. We will review the insurance that you hold currently through the UW-Madison. We will talk about how plans will change come January 1st, 2025. And we'll discuss which of your plans would end if you do not take action during this annual benefit enrollment period to re-elect those coverages. We will also discuss about your decisions to be made. Which benefits do you want to be in effect January 1st, 2025? And what changes, if any, do you desire to make to your plans that then will be effective January 1st, 2025? And finally, we'll talk about enrolling or making changes or submitting without change the benefit elections you would like to be in place for January 1st, 2025. All such submissions should be done online, generally speaking, and the deadline to make your submission is 4:30 p.m. October 25th, 2024. Our presentation is divided into two. The first section of the presentation will be to discuss the changes occurring in benefits for January 1st, 2025, and the actions you need to take in order to ensure you have the benefits you want. The second portion of today's presentation will be a review of the benefit programs offered through the state and the University of Wisconsin-Madison. We'll discuss briefly how the health insurance and health savings account plans work. We'll review the overviews of dental, vision, and accident insurance. We'll describe how the pre-tax accounts work if you were to be enrolled in them. And we'll review the basics of the life insurance options, accidental death and dismemberment options, the disability insurance. For those who are part of the Wisconsin Retirement System, we'll touch on the Wisconsin Retirement System contributions for 2025, and we'll discuss other supplemental retirement plan information. So let's begin. How do you know what insurance you have now? How will your plans change going into 2025? And which of your plans will end if you do not re-elect them this annual enrollment period? Let's review. Step 1, check your current benefits enrollments. To do so, you can visit your MyUW portal and view your benefit information tile. As you view your benefit information tile, you can click the lower portion of that box, View Benefits, and a summary page of your current benefit elections will open, and you can review the plans in which you are enrolled or have waived out of for this year. Another way to review your current benefits is to open your payroll information box's Earnings Statements section. When you review your earnings statements, you see the pay that you're receiving from the university, and you can also see the deductions that are being withheld from your pay. So whether they're withheld before tax, after tax, or the employer is contributing to the benefit cost, there is a cost associated with all of our insurance plans, and you can view the deductions that are being withheld on your earnings statements. Step 2 of your review will be to use the Wisconsin Department of Employee Trust Funds, or ETF's, resources, as well as our resources offered through UW-Madison to better understand the benefits you hold today and understand how they will be changing come January 1st, 2025. Two initial resources offered from Employee Trust Funds is their video called Choosing a Plan Design, which allows you to review the traditional deductible versus high deductible plan offerings and the Wisconsin-based versus the nationwide plan design offerings and determine which will better meet your family's needs for the coming year. There is also a web page of theirs called Steps to Choosing Your Benefits, which allows you to review the methods by which someone would consider all of their options and ultimately make decisions on which benefits will be best for them for the coming year. And it is Employee Trust Fund's Decision Guide for 2025 to which my office would direct you for most of the information to come about 2025 health, dental, vision, and accident insurance benefits. This publication provides the premium cost for employees if they were to enroll in the various types of plans, and provides an overview of what the plans cover. As for the benefits unit in UW-Madison, we have designated on this slide an overview of what is changing come 2025 and what is not changing about insurance come January. So what is changing are that health premiums will be increasing for 2025. Coverage itself is also enriched, and the high deductible health plan deductibles and health savings account contributions are also being adjusted. There's a special enrollment for individual and family life insurance being offered this fall. There are 2 life insurance plans which will end December 31st of 2024. And there is an increase to the required Wisconsin retirement system contribution. What will not change are the vision premiums and coverage, the dental supplemental premiums and coverage, which would include the preventive dental, the Select and the Select Plus supplemental dental plans. And also not changing the accident plan through Securian. Its premiums and coverages remain the same going into 2025. Here is more information about the additional covered services offered with the health insurance as of January 2025. There will be more orthoptic eye training allowed, and nutritional counseling coverage is clarified that it can be a service covered related to weight management. Also changing is the name of the previous, or I should say current, for 2024, Dean Prevea 360 West network. It will have a new name, which will be Dean Medica West Mayo, come January 1st. Various counties within Wisconsin are served by this network. You may or may not be enrolled yourself, but there is no action required of you if you do have the Prevea 360 West network in 2024 and you want to roll into the newly named Dean Medica West Mayo network come January 1st. The transition will occur automatically. However, when we speak of health plan networks, we know that any plan can have updates to which physicians are in network versus which physicians are no longer in network, and to review what your plan offers for who is in versus out of network. Do review Employee Trust Fund's website. They have a health plan search webpage to which is linked the various networks available through the state of Wisconsin. You should review your own network and ensure that the doctors that you want to visit in the coming year are still listed as covered providers. One significant change with Group Health Cooperative of Eau Claire has been called to our attention. The Mayo Clinic will not be a network provider for either the Greater Wisconsin nor River Region versions of the GHC Eau Claire networks come January 1st. For 2025, the high deductible health plan, whether it's the Wisconsin-based or the nationwide access high deductible health plan, the deductibles are increasing to meet IRS minimums that are required to ensure we have a qualified high deductible health plan. The single deductible will be $1,650, and the family deductible will be $3,300. So a quick overview of the health insurance plans. Again, the change to the programs are with the high deductible health plans deductibles. They are increasing starting January 1st, 2025. Beyond that, though, the lower deductible plans and how the programs work, whether it's the medical coinsurance, the out-of-pocket limits, those are remaining the same. Premiums are increasing for 2025. You see on the screen before you the new monthly premiums that most employees will pay beginning in January. There's an increase overall of between 7 to 10%, depending upon which of the programs it is in which you're enrolled. And because some of our employees pay not just the regular employee contribution towards health, but they pay an actual percentage of the health insurance cost itself, whether that is 50% or 100% of the health premium. You will also, if that covers your situation, want to go to Employee Trust Fund's website and look at the total premiums for 2025 to better understand what you would pay for the total or 50% health premiums. starting in January. As mentioned earlier, there are 2 life insurance programs which are ending come December 31st. These are the UW Employees Inc. Life Insurance and the University Insurance Association life insurance plans. Any employees who are being affected by this end of coverage were sent emails in September. Now, because these 2 programs are ending, there is a new special enrollment offered for the individual and family life insurance. The individual and family life insurance will allow you to enroll up to $100,000 worth of coverage on your own life during this annual benefit enrollment period. Or if you are already enrolled in the individual and family life insurance, you could increase the coverage you hold on your own life in $5,000 increments up to as much as another $100,000. The maximum for coverage on your life through this program is $300,000. If you already have INF coverage on yourself and your spouse and your children, this is the time of year in which you can increase the coverage on your spouse or your children's lives. Again, whether it's by $5,000 increments or $2,500 increments, and there is the coverage maximum for each of those programs noted on the slide. The third step for our review is to ensure you have gathered your spouse and dependent details if you will be adding them to your health, dental, or vision insurance this fall. You will need legal names and sex, dates of birth, your date of marriage, and social security numbers. So the decisions that lie before you are: what benefits do you want effective January 1st, 2025? And what changes, thus, will you need to make to your plans to ensure you have that coverage? There are certain benefits programs that require your action during the annual benefit enrollment period if you want to have those programs to be effective January 1st. This is true even if you had the coverage in 2024. The health opt-out incentive must be re-elected every fall if one wants to continue to receive the incentive the coming year. The Health Savings Account is a program in which you must re-elect the benefit if you want to continue to be part of the high deductible health plan for the coming year, and to contribute new money into flexible spending accounts, whether that's the Health FSA, the Limited Purpose FSA, or the Dependent Daycare FSA. You must re-elect another new amount to contribute in 2025 if you wish to do so. This slide provides an overview of health insurance changes that can be made this time of year. You can elect or re-elect the health opt-out stipend. Again, if you do not take action, even if you had the stipend in 2024, the coverage will end come January 1st. You may also make changes to your state group health insurance, whether that's to enroll anew or to change your plan design, to add or remove preventive dental, to change which doctor group you and your family will visit for the year, to change the deductible levels, or to add or remove family members. All are available to you at this time of year. Electing the Health Savings Account is a requirement of you if you want to be enrolled in the high deductible health plan come January 1st. And of course, the Uniform Dental Insurance is the preventive dental that can be attached to your health election. So if you are enrolling in health insurance and you want that preventive uniform dental coverage, you must choose the health insurance with the "and dental" name in its description. Other supplemental plans may also be adjusted this time of year. The preventive dental insurance, if you are waiving or have opted out of health insurance, can be elected on its own. You may also elect or make changes to your supplemental dental insurance coverage, your vision coverage, the accident insurance, and the flexible spending accounts. And finally, the individual and family life insurance is offering their special enrollment this time of year, and they also allow those who are already enrolled to increase their coverage up to the maximums allowed by the plan. The accidental death and dismemberment policy offered by the UW is eligible to be elected at any time of year, and you may do so at this time of year. If you are interested in other insurance plans, such as the State Group Life Insurance or the ICI Disability Insurance, those programs do not take part of this annual benefit enrollment period, but you still could, if you're not already enrolled in them, you could apply for them at any time of year using a paper application called the Evidence of Insurability form. You have to pass a medical underwriting process in order to be approved for those plans if you're no longer a brand new employee. And the EOI application could be denied if the insurance company decides to deny it. When it is time to share your decisions with my office, how to submit and how to confirm that your submissions were received is what we address next. I will confirm that everyone should submit their benefits choices during this annual benefit enrollment period for the effective date of January 1st, 2025. And you can review how to make use of the online enrollment process through a quick video offered by the UW Service Center, which we link to on this slide. Step 1 is to choose your 2025 benefits in the MyUW self-service portal. You will log in to your MyUW portal with your NetID and your password. Then visit the Benefit Information tile, and you should see an Enroll Now button in the middle of that tile. Click through that Enroll Now button, and a portal will be opened, allowing you to confirm your name and contact details, other insurance coverage that you might have outside of the UW-Madison, and ultimately it takes you to the portion of the portal where you make your decisions about benefits for next year. There is an online written guide on how to use the self-service portal if you would prefer that to the video. Again, it's offered through our UW service team, and I link to the Quick Start Guide on this slide. Some special notes about the health opt-out incentive. If you are newly electing the opt-out incentive and making this change in the portal, make sure that you have not included your spouse or dependents as part of the election. If your family members are checked as part of your enrollment into the opt-out incentive, the system will error out. Your new State Group Health election, if done successfully, will say Health Insurance Opt-out Incentive. If the new line instead says Waive, you did not successfully elect the opt-out incentive. Also, regarding the health opt-out incentive, once you receive your confirmation statement, it should look something like this, where the benefits plan states it's describing the health insurance opt-out incentive, and the coverage should note that you are enrolled. If instead it says Waive, or it says State Group Health Insurance, Waive, then you will not receive the opt-out incentive. Also, a note about health insurance and preventive dental insurance options. If you want both health insurance and preventive dental, then your dental election is part of your health plan submission. You elect the health plan that you would like and choose the version that has "and dental" as part of its title. And then when you are back onto the main screen of your benefits portal, you will see that the standalone preventive dental is grayed out because you did elect the "and dental" version of the health insurance. Or if you are waiving or opting out of the health insurance, but you do want the standalone preventive dental, go into the health portal first, select to either opt out or waive as is appropriate for you, and then you can visit the preventive dental square and elect it as you choose. And remember, if you are choosing to add a family member to your health, dental, or vision programs this time of year so that their coverage will be in effect January 1st, you must be prepared when you're in your portal to enter all of your spouse and dependent information, which will include their full legal names, their dates of birth, legal sex, and social security numbers, or if they don't have a social security number, be prepared to submit to us the affidavit for insurance purposes form. And then step 2 of the enrollments and submissions is to ensure you have made your submission by deadline. We must receive your submission, whether that's a new enrollment or a change or a confirmation that items will remain the same or any cancellations. We have to have received that from you no later than 4:30 p.m. on Friday, October 25th. Submit either online through the self-service portal, which is ideal, or if you are unable to submit an online submission, you can submit a paper application to your local HR contact. Again, while the online enrollment through the portal is ideal, if you must submit a paper application, you can do so. Simply find the form via the website and then give it completed to your HR or payroll contact. If you must email your forms, do not write your Social Security numbers on the forms and instead follow up later to provide the Social Security numbers via phone. The third step in this time of year is to ensure that your confirmation statement is correct. 24 to 48 hours after you have submitted your choices to us online, look for an email to be delivered to you and follow the email's instructions to view your benefit enrollment confirmation statement. Do review your statement during the annual benefit enrollment period. If you were to find anything amiss, reach out to your HR or my office immediately so we can let you know how to make any changes or fixes that you would like to make in your original submission. Otherwise, if all on the confirmation statement is correct, keep the statement as reassurance that all has been received successfully. Another way to view next year's benefit summary is to, in the MyUW Benefit Information Portal, remain on the Summary page and click the View Benefits Summary Detail button. And then the new view will open up a summary of your current benefits that you hold as of that very day. Change the benefit view date to a date in 2025, and that will also be another way to confirm what benefits you will hold come that future date next year. And if you are not able to submit your choices for 2025 online and instead have to submit paper applications, remember that your forms must be received and signed in by your HR contact no later than 4:30 p.m. on Friday, October 25th, and you must keep a signed and dated copy of any of the paper applications you submit as your receipt, essentially, that you did submit them timely. We will process your forms in the order we receive them and watch for your confirmation statement to be issued on November 30th. Thank you for attending this presentation about the changes to come for Benefits 2025. If you would like to learn more about the insurance plans being offered to employees at UW-Madison, stick around. We'll talk more about health and dental and vision insurance coming up. But if you now do feel confident that you understand how the benefits are changing and how you can submit your choices to us for this coming enrollment period, and you choose to leave now, please do and email us should you have other questions. benefits@ohr.wisc.edu. We are always willing to assist. For those who wish to stick around a bit and learn more about insurance, let's start off with health insurance. Speaking of the health insurance plan itself, as well as the uniform dental insurance that can be attached to its selection. A quick overview of the items you might be considering when you think about insurance for health come 2025. You'll want to ensure that the setup in our computer system is correct. When you go into the enrollment portal, does the system show that you will be enrolled in the correct plan for the new 2025 year? Or does it show you as waived? Did you mean to waive? If, rather than waive, you want to opt out of the insurance for 2025 and receive the incentive payment, you will see initially the system is set up as waiving your health insurance. And you'll want to go in and make the adjustment so that you select the opt-out incentive to begin January 1st. This is also the time when you can make changes to your health plan design or who you decide to visit as your in-network providers, which of your family members may be covered, and whether or not you want that preventive uniform dental attached to your health election. You will see some acronyms used on the upcoming slides. SGH stands for State Group Health Insurance. HDHP stands for High Deductible Health Plan. Non-HDHP are the health plans that are not high deductible, and HSA is the health savings account, which is a bank account someone must open if they're enrolling in the state's high deductible health plan. You may be pleased with the health insurance you have now with the state. That doesn't mean that you shouldn't take action, however, this time of year. You may indeed need to act to keep the coverage that you enjoy. For example, the high deductible health plan requires you to re-elect the health savings account each fall for the coming year. If you don't take that action timely, then rather than being part of the high deductible health plan in 2025, you will be moved to the non-high deductible health plan version of your coverage. The opt-out incentive as well requires action on your part. You must re-elect the opt-out incentive if you wish to receive those payments in 2025. If you do not, you will have simply waived the health insurance and will not receive the incentive pay come January. And also, you may now enjoy the doctors and clinics that are part of your chosen network, but you should review your plan's 2025 provider network listing, just to ensure that your current providers whom you enjoy remain part of their network in the coming year. Or if you learn there have been changes, you can then reassess which network is best for your family for the coming year and take action to make a change if you decide that is best for you. It is Employee Trust Fund's Health Plan Search website where you can find more information about each of the health networks, which group of physicians you may choose to be yours for the coming year, and you can search for the different doctors and clinics on and through this website. During the annual benefit enrollment period, you have a choice between the deductible for your health insurance, whether it's the traditional low deductible copay plan, or you may elect the high deductible health plan with its health savings account. If you're enrolling in one of the deductible styles, you must also choose a group of doctors to be your doctors for the year, whether that's one of the Wisconsin-based plans, such as the network with Dean or the network with Group Health Cooperative or Quartz UW Health, or it could be the nationwide network, which is called the Access Plan. Otherwise, if you're not interested in being part of the state's health insurance, you might choose to opt out of the coverage or waive the health insurance. If you choose one of the regional Wisconsin-based plan designs, whether that's the low deductible or high deductible version, you must receive your medical care from in-network providers only. You do not have coverage for medical care if you go outside of your network, unless it was for an urgent or emergency care need. The nationwide design, so the Access Plan and its high deductible version, allows care from providers both in-network and out-of-network. There is less coverage if you go out of network. You would pay more for your services received, but you do still have coverage under the Access Plan, even if you step outside of that network. If you plan to seek medical care outside of Wisconsin in a surrounding state, such as in eastern Minnesota or northeastern Iowa, there may be a Wisconsin-based plan that works for you and your family. You may not, for example, need to sign up for the nationwide access plan. One of the local Wisconsin-based plans may still work for you in that nearby surrounding state. Review Employee Trust Fund's website, its health plan search site, for more details if that in fact describes the needs of your family for the coming year. And for additional review of the health plan designs, ETF's video is a valuable resource. Listed on this slide, coming from page 3 of Employee Trust Fund's decision guide for this coming year, are the premiums that most of our employees will pay each month if they were to enroll in health insurance. Our Wisconsin Retirement System eligible employees have their premiums listed, whether it's for individual coverage alone or family coverage, which would include the employee plus family member or members. Or there's the UW Grad Assistant premiums, which would be for our grad assistants, RAs, TAs, and other shorter term employees that could be academic staff, short term, or very part-time academic staff. This could also include our fellows and scholars, those who are eligible for the insurance programs. Or if you were a Wisconsin Retirement System participant who works less than half-time and you enroll in the health insurance, you would pay 50% of the total health premium each month. The UW would pay the other 50%. Or if you were on an unpaid leave of absence for more than 3 months, you become responsible for 100% of the monthly premium for your health coverage. To find these dollar numbers, please view Employee Trust Fund's website, searching total premium. Many of our employees live in Wisconsin, and thus many of them choose a Wisconsin-based plan. And if that is you as well, whether you want the traditional deductible health plan or its high deductible version, you must also choose a group of doctors to be your doctors for the coming year. Here in Dane County, that often means that you're choosing between Dean or GHC of South Central Wisconsin's Dane Choice Network or the Quartz UW Health Network. If you were to choose one of these Wisconsin-based plans, remember that you need to stay within your network in order to have coverage through the insurance. If you go outside of the network, only emergency or urgent care needs can be addressed through the insurance plan. If you are in need of nationwide coverage or for coverage from a state outside of Wisconsin, then the Access Plan or its high deductible version may be for you. This program is run through Dean, and Dean is the network of choice in southern Wisconsin through the Access Plan, as well as providers through First Health throughout Wisconsin and nationwide. If you're part of the Access Plan and you visit a provider who is outside of the Dean or First Health networks, you do still have some insurance coverage, even if you didn't need care for a medical emergency. However, you will pay more out of pocket for those out-of-network services. We pay for our insurance premiums each month, split between the first and the second check of the month. So for example, the first change in premium costs will be seen on the first check received in January on January 9th. You would pay for the first half of the new January premiums. And then on the second check you receive in January, dated January 23rd, you would pay for the remainder, the second half of the January premiums that were due. With our health insurance programs, there is an annual medical deductible to meet before the insurance program will pay for most services. Now with the traditional style health plan and access plan, the medical deductible is $250 per person per year, not to exceed $500 per family per year. And office visit copays and prescription drug copays do not count towards that deductible. They are separate. Under the high deductible health plan and the access high deductible health plan, the deductible is higher. It is now $1,650 if you have a single high deductible health plan, or it will be $3,300 if you have the family high deductible health plan. And for those with that family coverage, you must meet the full family deductible of $3,300 before the plan's coinsurance and copays can begin. This means that on a family plan, if it's even just one person in need of surgery, the $3,300 must be met before the medical coinsurance would kick in after. Now, medical coinsurance is when the insurance company pays a percent of the bill and you pay a smaller percent of the bill after your deductible has been met. So after the deductible, you would pay just 10% of additional medical service bills for x-rays and lab work, or you would pay 20% of the cost for durable medical equipment, such as slings and crutches. And you would, if carrying on with additional services, continue to pay your 10% or 20% for expenses until potentially you met the plan's medical out-of-pocket limit for the year, which is the most you would pay each year for covered medical services. Under the health plan and the access plan, the medical out-of-pocket limit is $1,250 per person per year. That includes the $250 deductible in that total. Or if you have family coverage and multiple people in your family were seeking care, it wouldn't exceed $2,500. If you have the high deductible health plan or the access high deductible health plan, the out-of-pocket limit is $2,500 if you have the single coverage, or it is $5,000 if you have the family coverage. And again, for those on the family coverage, you must meet the full family out-of-pocket limit of $5,000 before the plan begins to pay 100% of remaining covered services for the year. Even one individual would be required to meet the $5,000 maximum if of the family they were the only ones in need of great medical costs that year. With health insurance, preventive care such as routine annual checkups and well baby care visits are covered 100% per the Affordable Care Act. You can see more about what is considered preventive care and covered 100% if you visit healthcare.gov. Again, for both the traditional deductible and high deductible plans, this holds true. Preventive services, when billed as preventive by your doctor, are free to you. However, for other sorts of office visit consultations, there will be a cost to you. If you're on the health plan or the access plan, you pay a $15 office visit copay if you're visiting your primary care provider, or you pay a $25 office visit copay if you're counseling with a specialist, such as a cardiologist. Under the high deductible health plans, you pay your full deductible before the office visit copays begin to be charged to you. An urgent care clinic visit would have a $25 copay. The emergency room would have a $75 copay, which could be waived if you were admitted to the hospital from the emergency room. Again, the health plan and access plan would require these copays kind of on top of the other urgent care or emergency room bill you might receive for medical services. The high deductible health plan and access high deductible health plan both require that you meet your high deductible first before these copays would be required of you. For prescription drugs, there is no deductible to meet for the health plan or the access plans or coverage. However, under the high deductible health plans, there is a combined medical and pharmacy deductible. So still, if you're filling prescriptions on the high deductible health plan, you pay 100% of pharmacy costs until your $1,650 deductible has been met if you were on the single plan, or your $3,300 deductible was met if you were on the family plan. Beyond that, there are prescription copays or coinsurance amounts for which you would be responsible for prescription drugs when filled at the pharmacy. Level 1 prescriptions would cost $5 or less under the traditional style plans. Level 2s would be you would pay 20% of their cost, up to $50. Level 3s and level 4s are more expensive specialty drugs. Level 3s would cost you 40% of their full cost at minimum. They're often quite expensive. Level 4 drugs would be a $50 copay, and you would fill those at the specialty pharmacy. Again, the high deductible health plan requires you to meet your deductible before those copays or coinsurance amounts would kick in. And with prescription drugs, there are still federally required preventive prescriptions that will be filled at no cost to you when you fill them at your network pharmacy. That's true for both the traditional and the high deductible health plans. There are out-of-pocket limits for your prescriptions over which you would not be required to spend additional money during the plan year. If you're on the health plan or the access plan and filling just level 1 and level 2 drugs, at most you would spend $600 per person on those levels of prescriptions, or at most $1,200 per family per year. For level 3 and level 4 drugs, there's a much higher out-of-pocket limit to hit. For the health plan and the access plan, it could be as much as $9,200 if on a single plan, as an individual, or up to $18,400 if many members of your family were all filling level 1, 2, 3, and 4 prescription drugs. Now, the high deductible health plans have a different out-of-pocket limit. Again, the pharmacy and medical benefits combine to create the medical and pharmacy out-of-pocket limit for the year. So it would not exceed $2,500 if you were on the high deductible health plan as a single individual, or it would not exceed $5,000 if you were on the family high deductible health plan. For those who are interested in enrolling in a high deductible health plan, there are requirements for those in order to be eligible. You must be part of the Wisconsin retirement system, which does mean that our short-term grad employee benefits program participants are not eligible. Also, you cannot be claimed as a dependent on someone else's taxes, nor can you be covered by some other non-high deductible health plan coverage or through a spouse's health flexible spending account, health FSA. You also must be approved for and open a health savings account, or HSA, with Optum. A health savings account is a bank account which you open through currently the state's contract with Optum Financial, and into that health savings account, your employer will contribute money. You can draw upon that fund to pay for some or all of your eligible medical bills during the year, or if unspent, your HSA balance rolls over from one year to the next. This is an account that you must open or re-elect each fall if you want to continue to be part of the state's high deductible health plan each year. In order to open the health savings account, you must pass a customer identification process. It's a part of opening this bank account. So after you submit your selections online this year, you may be contacted by Optum Financial, who would request more information from you. If they do ask you for additional information in order to open your health savings account, you must provide it to them within 90 days. They may need your full legal name, they may need more information about your current physical address, they may need your date of birth or a government ID, and we at the university cannot help you through this CIP process. Because of various banking guidelines, Optum will not communicate with my office the details about your CIP status, other than once it's been completed, they will let us know if it was approved or whether it was not successful and you have been denied the health savings account. Again, you must be successful in opening the health savings account if you want to be part of the state's high deductible health plan. If you do open the health savings account and you are an academic year employee, your academic year contributions from the employer will be over 18 paychecks, just those through the academic year only. They will not be processed from any summer paychecks. And along with the health insurance, you have the option to attach to your health election the preventive uniform dental plan. So each plan has a plain health option or an option that says and dental at the end of its name. And if you select that and dental version, that means that you will have the preventive uniform dental as part of your health election. That does mean paying an extra $4 to $10 each month for health insurance compared to if you hadn't elected the dental version. But it will mean that you and your covered family, who are part of the health insurance with you, will be able to go in for routine cleanings and exams. Your children will be able to have fluoride treatments, all covered 100%. Fillings are covered 100%. Anesthesia and emergency pain relief are covered at 80%. But major services like crowns, bridges, implants, and oral surgery are not part of this dental coverage. Those could be possibly covered through the supplemental dental, which we'll be discussing shortly, but they're not part of this preventive uniform dental plan. What can be part of this, though, is orthodontia coverage for your dependent children. This program, if you have dependent children under age 19, could have ortho coverage of 50% of the bill, up to $1,500 per each child's mouth for their lifetime. And if you decide not to enroll in the health insurance at all and instead wish to pursue the opt-out incentive, there are rules on who is eligible for the opt-out incentive. For example, you must be a Wisconsin retirement system participant and not instead eligible for the grad benefit program. If you're interested in learning more about the criteria for the opt-out, Employee Trust Fund's website has a section on FAQs about the opt-out incentive. And perhaps you're currently participating in the opt-out incentive and thus may choose to take action this annual enrollment period to re-elect it so that you continue to have it come January 2025. A 2024 incentive does not automatically carry over into 2025. It requires action from you. This is a quick screenshot of what you might view when you go into your Stake Group Health section of the portal for the annual benefit enrollment. Whether it's the very first option or the very last option, if there is a health insurance opt-out incentive option for you, you will see it listed and you could select it if that's what you choose instead of enrolling in the health insurance for the coming year. Next up, we will discuss dental, vision, accident, and accidental death and dismemberment plans. The plan administrator for the dental insurance is Delta Dental of Wisconsin, and you could reach out to their member services line or view their website if you have questions about the coverage that they offer. For those who have waived or opted out of the health insurance, there is a standalone preventive dental plan that you might elect. And for those who are interested in major dental coverage, services for crowns and bridges and implants and oral surgery, you have the choice of either the Select or the Select Plus plans. Now, when you compare your options, you want to consider which dental providers you'd be allowed to visit if you were to enroll in the plans. Note that the Preventive and Select Plus plans would work with both Delta Dental PPO and Delta Dental Premier providers, while the Select plan requires you to visit Delta Dental PPO providers only. There is an annual deductible of $100 per mouth per year if you choose the Select plan, or $25 per mouth per year if you have the Select Plus plan. The most these plans would pay out towards a mouth each year would be, for the preventive plan, $1,000 for those routine cleanings and exams and children's fluoride treatments. Or for the Select plan, it would be $1,000 as its share of the coverage for crowns and bridges and oral surgery, those types of major services. They'll pay 50% of the bill up to $1,000. If you choose the Select Plus plan, after the $25 deductible, it will pay up to $2,500 per mouth per year for those major services. It would pay 60% of the cost of your crowns, bridges, or implants, or 80% of the cost of oral surgery, for example, up to $2,500 per person per year. The Select Plus plan also offers some orthodontia coverage for adults. So if it is someone in your family or you yourself who is in need of orthodontia work and you are 19 years or older in age, you could select or you could choose the Select Plus plan and have up to $1,500 or 50% of your bill covered through that program. The preventive dental insurance plan, if you're waiving or opting out of health insurance, has the price of $36.10 per month if it's just you whom you're enrolling into the policy, or it would be $90.28 per month if you're covering other members of your family on that preventive dental along with you. If you choose the Select plan for its major dental, you would pay $9.08 per month if it's just you on the plan, or there would be a larger charge if you're covering other members of your family. If you choose the Select Plus plan for the major dental coverage, it would cost you $21.60 per month, or more if you wanted to add additional members of your family to the coverage as well. And because there's often confusion on the uniform dental versus preventive dental plan, I'll reiterate here that if you are enrolling in the Stake Group Health Insurance, to elect preventive uniform dental, you must choose it as part of your health election. You choose your dental plan and dental in its title. And then you do not need to worry about the preventive dental box. It will be grayed out because you already have the uniform dental, which is offering its preventive coverage. However, if you are waiving or opting out of the Stake Group Health Insurance, then the uniform dental is not an option for you. And instead, after you've waived or opted out of health insurance, when you visit the preventive dental enrollment box, you could elect the standalone preventive dental if you would like to. And of course, with any of these options, you're welcome to choose either the Select or the Select Plus plans for their major dental coverage. For vision insurance, we again have the Delta Vision program as our plan administrator. And once more, you can reach out to them directly through their member services line or their website if you have questions about the benefits they offer. The premiums for vision insurance cost $5.75 per month if it's just you covered up by the policy. It would be $11.42 a month if it's you and your spouse, $12.88 per month if it's you and your child or children, or $20.58 per month if it's you and the rest of your family, which would include spouse plus a child or children. To receive the best coverage through the vision insurance plan, visit iMed's Insight Network. You can search for an eye doctor through their network, either on their website or by calling their member services line. With the vision insurance, if you're visiting your in-network provider, you may have one routine vision eye exam, a well eye vision exam each year, and you would pay a $15 office visit copay. If you want a basic pair of frames, a basic pair of lenses, those will cost a $25 copay, and you can have a new pair of lenses every 12 months, a new pair of frames every 24 months if an adult, or every 12 months if you're a child. If you would like contact lenses instead of eyeglasses, you will be able to purchase up to $150 of contact lenses covered through the insurance plan. And if there are additional purchases to be made for contact lenses, you'll receive a 15% discount off of that additional purchase. And you have access to the accident plan with Securian if you're interested in enrolling for 2025. This accident plan would pay you cash in the event that you are injured in an accident and seek timely medical care, and then submit a claim following up. For example, if you received a concussion after tripping and falling over a fence, were rushed to the hospital in an ambulance, received a CT scan, after all of your care is said and done, submit your claim to Securian, and they would have a certain dollar value associated with those sorts of medical services that you received because of the accident, and they would provide you with a check mailed to you. The accident plan coverage costs $3.72 a month if it's just you who's on the plan. It'd be $5.32 if it's you and your spouse, $7.16 a month if it's you and your child or children, or $10.46 a month if it's you and your spouse and your child or children. And as a note, a reminder, if you have a spouse or parent who is also eligible for this state accident insurance, know that you can cover yourself as an employee or be covered as their dependent, but not both. With the accident plan, you are responsible for submitting your claims to Securian directly. You must submit claims by deadline, which may be within 30 days of the accident, and see our website and the plan certificate for more details. We also at the UW-Madison have access to the Accidental Death and Dismemberment, or AD&D policy with Zurich. The Zurich AD&D policy allows us to enroll in, increase, decrease, or cancel out of coverage at any time of year. This is a plan which you'll see in the annual enrollment portal, and you may elect, increase, decrease, or cancel your coverage as desired. If you choose to elect family coverage and it were your spouse, partner, or child who were accidentally injured or killed in an accident, then a percentage of the coverage you elected on your own life would be paid out to you because of their accident. If you're enrolled in the Zurich AD&D policy, you must file claims with Zurich directly and submit those claims by deadline, which may be within 90 days of the accident. Please see our website and the plan certificate for more details. Next up, we're talking about the pre-tax spending accounts. So we have the flexible spending accounts, also called FSAs, and the transportation accounts under Section 132. It is Optum Financial who is the administrator for these pre-tax accounts. Flexible spending accounts must be re-elected each year if you want to continue to contribute pre-tax money from your paycheck. Your 2024 FSA election does not automatically carry forward to 2025. You must re-elect a new amount of money to contribute, if desired, for the healthcare flexible spending account, or the limited purpose flexible spending account, or the dependent daycare flexible spending account. The purpose of flexible spending accounts is to reduce your taxable income. And the way that can happen is rather than paying to you the money that you earned as a wage, but before it arrives in your bank account, income taxes are withheld from the top of that pay. Rather than doing that, you can elect a flexible spending account and have the money you earn as income sent to the flexible spending account vendor. That way there is no tax withheld from the dollars that you're sending to your FSA, neither does it arrive on your paycheck. It is sent directly to the flexible spending account, and then you would work directly with the flexible spending account vendor to access the money that you have sent to your FSA. You may only spend your FSA money on qualifying expenses that you incurred within the eligible year. A health FSA can be used to reimburse yourself for certain medical, prescription, dental, and vision expenses. A limited purpose FSA is for those who are part of the state's high deductible health plan and want additional pre-tax dental and vision options available to them. And the dependent daycare election would be to reimburse yourself for certain after-school care for your dependent child or a dependent adult. The annual minimum requirement, if you're going to elect the health or limited purpose FSA, is $50 per year. At most, you could contribute up to $3,200 into the health or the limited purpose FSA. The dependent daycare FSA would allow $2,500 or up to $5,000 per household per year as its annual contribution maximum. And there could be a possible carryover of unspent 2025 FSA monies allowed to carry over into 2026 if you continue to be an eligible employee into 2026. At most, though, it would be $640, and only the health and limited purpose accounts can have any carryover. The dependent daycare account never has a carryover. There is a $50 minimum for the carryovers for the health and limited purpose FSAs if one isn't re-enrolling in the FSA again for the following year. For example, perhaps you have a health or limited purpose FSA in 2024. The question is your unspent balance $50 or more at the end of the plan year? If yes, your account in the health or limited purpose FSA is $50 or more, or you are re-enrolling in the 2025 health or limited purpose FSAs, then that balance remaining unspent from 2024 will eventually carry over and be available to you in 2025. Note that there's the maximum allowed for carryover, and those carryovers usually aren't available until April or May of the following year. Now, if your current health or limited purpose FSA for 2024 has a balance of less than $50 at the end of the plan year, and you do not re-enroll in the 2025 health or limited purpose FSA, then you will lose any remaining unspent balance from 2024. So these accounts, again, do allow a potential carryover, but in part, the question is, what is your balance that could be carried over? And have you re-enrolled in the FSA again for the following year? Those pieces do matter. With the flexible spending accounts, if you have the health or the limited purpose elected, those accounts are pre-funded with a debit card loaded with your full election available to you as of January 1st, 2025. If you have the dependent daycare FSA, there is no starting balance available in your account, nor is the debit card associated with the account. But as you incur expenses for your dependent's care, you can submit claim forms through the FSA and be reimbursed up to the amounts that you have run through payroll already that year. see in more detail what is available to you in your FSA, you would visit your online portal through the Optum website or download the smartphone app available with Optum. These also make it easy to submit claims when you have them to Optum so that you can receive your reimbursements. A very important part of flexible spending accounts is the substantiation of claims. You must prove via certain documentation why you're accessing the money in your flexible spending account. Optum is required to confirm that you're accessing the money for eligible reasons, since it is a pre-tax account. The IRS is strict about those rules. And if you do not or cannot substantiate your claim in the time allowed, your claim must be denied by Optum. And if you had already used your debit card to pay for the item, you must repay the FSA directly. And in the meantime, your debit card will have been turned off. Or if you don't repay the money that had been paid from your FSA, that amount must be collected from your paycheck. Also available through Optum are the parking and transit pre-tax accounts. Now, these elections can be made at any time of year, and you will not see these as options in the online enrollment portal. Instead, if you want to participate anew in the 2025 parking and transit accounts, you must submit paper applications to your HR office. The money that you send to the accounts is available as you deposit it. And note that the parking account is for eligible post-tax parking expenses that you may incur. If you already pay the UW Transportation Office a pre-tax amount for their base lot permit, you probably do not also need this pre-tax parking account unless you have other post-tax parking expenses in your life. For the transit account, that's for eligible transit expenses. For example, if you already pay for the UW-Madison Metro Bus Pass pre-tax from your paycheck, you probably don't need this additional transit account. But if you do have other post-tax transit expenses, the transit account could be for you. There are more details about how parking and transit accounts work on Employee Trust Fund's website, on Optum's website, and on our UW website. There is an annual minimum contribution allowed if you're going to re-elect for a year, and there is a monthly maximum contribution of not more than $315 per account. There is also unlimited carryover allowed from one year to the next, as long as an employee's account balance is at least $50, if not more, or if they re-elect the coverage for the following year and add new money to the account. For more information about flexible spending accounts and health savings accounts and those transit and parking accounts, reach out to Optum Financial. You'll also find resources on the IRS website. There's the IRS publication 969, and there's the IRS publication 503, which may be of use. We have a few other plans to review quickly before we say goodbye. We'll start with the Wisconsin Retirement System. For those of us who are part of the Wisconsin Retirement System, you'll see your contribution percentage will be slightly higher in 2025. It's going from 6.9% in 2025 to 6.95%. And the first paycheck to be affected by this increase will be the January 9th paycheck. For those of you who are current participants in 2024 in the individual and family life insurance policy, should you wish to decrease or cancel your INF coverage, you may do so at any time of year by submitting a paper application. Or if you'd like to arrange to decrease or cancel your coverage during this annual benefit enrollment period, you may submit that change in the self-service portal, and it will take effect January 1st. If you are not enrolled but wish you were enrolled in the State Group Life Insurance or the Income Continuation Insurance, you may apply for either of these policies at any time of year. However, they are not open enrollments. Instead, you may apply for them through what they call evidence of insurability. There's paperwork you need to submit to prove that you are in good health. And depending upon how the insurance company reviews your paperwork, they could deny your application based on your evidence of insurability detail. The EOI forms are available on our website. And again, you may review those forms, complete them, and submit them directly to the insurance companies at any time of year. It doesn't have to be during the annual enrollment period. We also have available to us supplemental retirement plans. As a member of the UW family, we have access to the UW's 403B and could submit an easy enrollment form at any time to begin our participation in that program. And as state employees, we may participate in the state's Wisconsin Deferred Compensation Program under IRS code 457B. The 457B enrollment is available online. You do need a plan enrollment code to access the enrollment portal, and you'll find that code in the flyer I linked to on this slide. At any time of year, you may enroll in the 403B or the 457B, and at any time of year, you may change, increase, decrease, stop, and restart your contributions from your paychecks. To make changes to the 403B, you can do so potentially online in the benefit information tile or by submitting a salary reduction agreement. To make changes to your 457B, you would log in to your account online and make the adjustments yourself on the website. And that brings us to the end of our presentation. I hope we have met our session goals by reviewing the insurance options, showing you how to see what insurance you have now and understand how the plans will change come January. Also, helping in your decisions, we have listed the types of choices you have in front of you and how to ultimately submit your choices to us through the enrollment portal online. Remember that the deadline to ensure we've received your submissions is 4:30 p.m. October 25th, 2024. Thank you for joining us today during this presentation. For questions you may have, reach out to your local HR contact or email my office directly at benefits@ohr.wisc.edu. For additional information about the annual benefit enrollment period, including additional plan resources and premium prices, visit our website, benefits.wisc.edu/2025. Thank you and have a good annual benefit enrollment period.